Hello and welcome to the Real News Radio. This is your weekly broadcast where we discuss current events, politics, the disinformation, falsehoods, and propaganda proposed by the government and their mainstream corporate-owned puppet media. Each week, because of what's been going on with the swine flu, we do a swine flu report. We're going to go ahead and start with that this hour, and then after that we'd like to take your calls as we continue with the news. This was reported August 19, 2009, by your name out of New York City. New York Funeral Home Association says prepare for 85,000 flu deaths. City officials are bracing for a surge of swine flu cases this fall, and funeral home directors need to be prepared to accommodate a possible related 50 to 85,000 deaths. The director of the Metropolitan Funeral Directors Association told a gathering of funeral home representatives in Forest Hills last week. As funeral directors, we really need to know what we're about to face, Martin Kazdan said. When swine flu comes back, it could be possibly devastating. About 15 officials from the area funeral homes attended the meeting sponsored by the MET FDA at Schwartz Brothers in Forest Hills August 6th. The MET FDA is holding 4 meetings in the city and 1 in Winchester this month to better prepare funeral homes for the possibility of increased deaths as well as a rise in the number of sick employees. Also, this was reported in The Sun, August 19th, 2009. Brit Media reports on H1N1 mass graves. Plans for mass graves have been drawn up to cope with a second wave of swine flu this autumn. Now I'm reading directly from the Sun newspaper. The chilling proposals are spelled out in a home office document discussed at a meeting of Whitehall officials and council leaders last month. It warns emergency plans may be needed in areas where there are not enough graves to cope. The 59-page document talks about using a grave that is for a number of unrelated persons, excavating mechanically in advance, and designed for efficiently preparing and mass use. Also, it was reported this past week that the nationwide revolt against government plans to implement a mass swine flu vaccination program in the United Kingdom has picked up steam. And a poll revealing that a third of the NHS nurses will refuse to take the shot. Despite nurses and frontline health workers being the primary target group to take the vaccine, just 37% of them said they would take the swine flu vaccine in a survey conducted by Nursing Times magazine. 30% said they would not be immunized, and about 33% said they were unsure. Of the 30% who said they would refuse the vaccine, 60% said the reason was due to fears about the safety of the vaccine following revelations that the shot will contain mercury and squalene and have also been linked with the killer nerve disease, Guillain-Barré syndrome. Another 31% said they would refuse the vaccine because they did not consider the risk from the swine flu to be great enough. The government responded to the poll by claiming that nurses have a duty not to infect their patients and urge them to take the vaccine. But it seems that many fear the health consequences of taking the vaccine will be worse than catching the flu itself. Now, this was reported in the UK Daily. Swine flu jab linked to killer nerve disease. Leaked letter reveals concerns on neurologists over 25 deaths in America. A warning that the new swine flu jab is linked to a deadly nerve disease has been sent by the government to senior neurologists in a confidential letter. The letter from the Health Protective Agency, the official body that oversees public health, has been leaked to the mail on Sunday, leading to demands to know why the information has not been given to the public before the vaccination of millions of people, including children, begins. It tells the neurologists that they must be alert for an increase in brain disorders called Guillain-Barré syndrome, or GBS, which could be triggered by the vaccine. GBS attacks the lining of the nerves, causing paralysis and inability to breathe, and can be fatal. The letter sent to about 600 neurologists on July 29th is the first sign that there is concern at the highest levels that the vaccine itself could cause serious complications. It refers to the use of a similar swine flu vaccine in 1976 in the United States, when more people died from the vaccination than from the swine flu, and 500 cases of GBS were detected. The vaccine may have increased risk of contracting GBS by 8 times. The vaccine was withdrawn after just 10 weeks when the link to the GBS became clear. The U.S. government was forced to pay out millions of dollars to those affected also. The Canadian Press, Monday, August 17th, Medical Journal advocates Canadian H1N1 pandemic czar. So Canada is now preparing for an H1N1 czar. Also this past week, the Secretary of Commerce, Gary Locke, and Dr. Toby Merlin of the CDC held a telephone conference, and I took part in it. And what they wanted the media to tell the public was to advocate that everyone take the vaccine, plan for staggered shifts, explain to employees about sickness, do not require doctor's notes, evidence that the H1N1 is capable of infecting much, much more people, and the whole thing was to promote the taking of the vaccine. CDC has a priority system as to who can get the vaccine first also. This was reported on CNN August 20th. Kids get a $40 gift card in H1N1 vaccine test. So they reported this past week on CNN, if you will take your child down and submit to the H1N1 vaccine test, they will get a $40 gift card if you want to become a guinea pig. Also, CTV reported World Health Organization predicts explosion of swine flu cases. The World Health Organization on Friday urged governments to prepare for a second wave of swine flu this fall, estimating that as many as 2 billion people could become infected over the next 2 years. That's about 1/3 of the world's population. The World Health Organization has stressed that most cases are mild and require no treatment, but the fear is that a rash of new infections could overwhelm hospitals and health authorities, especially in poorer countries. The World Health Organization has predicted many countries may see swine flu cases double every 3 days for several months until peak transmission is reached. So all this information came out this past week on the swine flu. They are definitely getting us prepared for the possibility of mass deaths this fall. So Brian, every week we do it, every week more and more information. Your thoughts on this week?
And we recently just had the Army National Guard advertising for job positions for internment relocation specialists.
Yes, we reported that, I believe, about 2 weeks ago. A video has come out. The National Guard is actually putting out for the job of internment relocation specialist.
Unbelievable.
And if you're not aware of what that actually may consist of, that is a guard for a concentration camp, and you can Google that, you can look into it. We did have it up on our website. I'm not sure if it's still there, but there's a lot of information out there if you look.
Even the official recruitment video into itself pretty much explains the whole deal.
Yeah, and the websites that had the job openings for the National Guard that actually listed the duties, and we reported them here. I mean, it was a guard for a concentration camp in a mass flu kind of forced vaccination situation, or martial law, basically. So there's a lot of preparation being done.
Even the perfect storm, economic collapse, and swine flu.
Yeah, as we've discussed with Bob Chapman here, so ironically, our economy's collapsing at the same time they're making preparations for mass deaths and mass forced vaccinations. As we were saying off the air, something new we haven't been able to really investigate. Maybe we can talk about it next week. Booster shot mandatory now for everyone going into the 6th grade. It was reported in the Record and Landmark yesterday, and I got the paper, but I didn't bring it in with me, so I want to make sure I've got my facts straight. But I do know someone's children are going into the 6th grade, and they had told me that there was a new shot they were going to have to take, and they were trying to get some facts about it, so I don't know if it's a state thing, federal thing, or what. So we want to continue with that. Again, if you'd like to call in, we're coming up on a break, but if you'd like to call in when the next break's over, we'd love to hear from our listeners. The phone number is 1 866-986-6396.